Hi, I'm Katie Ayers with the Medicine Hat SPCA, and this month on Critter Care, we're focusing on senior pets. And we're going to be meeting with Trudy from Save Old Souls to talk about reasons why it's a good idea to consider a senior pet to adopt. And then we're also going to be meeting with Dr. Storch from Cypress View Veterinary Clinic, and they have a rehabilitation center there. It's the only one in Southeast Alberta, and they're going to be talking us through some different exercises you can do to help your pets with mobility issues as they age. Welcome back to Critter Care. I'm here with Trudy McKinnon, and Trudy was with the Save Old Souls Canine Rescue Group for quite a few years. And she, her last position with the group was as the board president. Trudy has a lot of experience working with senior animals, especially with senior dogs, so we wanted to ask her some questions today from her perspective and from her experience. So Trudy, can you tell us a little bit about your years with SOS and how many animals you fostered and kind of what your experience is with senior pets in general?
Oh, I started out as a foster home for SOS, and the then president convinced me that, you know, we should attend meetings and be on the board and so on.
Got more involved from there.
Yeah. And I've fostered 15 dogs on a kind of a long-term basis, you know, from entry into the program to adoption.
Okay.
And many, many more have parked their carcasses in my house, on my bed, for just short-term care.
Temporarily. Yeah, so you've obviously had many dogs, and SOS specialized in dogs, had many dogs go through your home. So you've certainly had a lot of experience working with senior pets.
Oh, yes.
As our pets age, there's different issues, of course, that we will encounter with their health, with their diet. What are some of your suggestions for pet owners from your experience? Things that we consider as our pets age?
Well, vision changes. They can become clumsy if you rearrange the house.
Right.
You know, so just vet care there, being aware of what's going on. Dental health, we cannot stress that enough. Ever.
That was one of the biggest vet bills I know that we encounter with senior pets, and I'm sure SOS had the same experience. Yeah.
Dentals. And the good thing, you know, when the dental is done, they usually do a pre-op blood test.
Right.
And that's excellent for pinpointing problems inside or potential problems. It also provides a really good baseline for where the dog is.
That's a good point.
Yes, so a blood test is a really good idea. They could be like my old boy and be deaf. And then in traffic and so on, they can't hear. You have to develop hand signals.
Okay.
And Jack and I have our own. They're not from any book or trainer or whatever. We just wing it, but he knows what I want, and I know what he wants. Good food. No human food, but a good food, especially a senior food, has minerals and vitamins that help with joints, and that's really important for a senior dog.
Absolutely. I find it interesting that you mentioned in terms of them developing some blindness and potentially some deafness as well, because sometimes we don't realize that that's happening until we take them out of their environment that they're used to. So they're already used to their house and the setup in the house and how to maneuver around different furniture. So that might be the first time that you realize that they are experiencing some eyesight issues or potentially some hearing issues as well, as when you have them in a different environment. So that's a really good point. Yeah. Now, we do have our Old Souls program, which we've started here, and part of that is kind of in response to SOS Rescue closing and just wanting to still be able to provide care for senior pets in our community. And so the community knows that, you know, of course, we're here for any animal that needs us, but we are for sure still here for the senior pets as well in our community. There is still an option for them. And what we've developed is more of a foster home network so that the senior pets, if needed, can go into a foster home if that's better suited for them than, say, a shelter environment. When someone is perhaps considering adopting a senior pet, so for example, we have Abby here with us, and Abby's 10 years old, and she's a medium-sized dog. What would you suggest from your experience that they would consider before choosing to adopt a senior pet?
The dog has to fit the lifestyle. You know, if you're a jogger and want the dog to run with you, you don't want a beagle.
Right.
You'll be stopping for sniffs everywhere.
Good point.
Likewise, if you're a senior with limited mobility,
Yes.
you don't want a dog like Abby who needs, you know, a good amount of exercise
She wants a good
and
walk
so
every
on.
day.
Yeah, consider, you know, their temperament. I always say you have to separate your heart and your brain. And, okay, is this dog good for me? Am I being realistic about wanting a dog to begin with? What about my work schedule?
Right.
You know, if I work late 2 nights a week, what am I going to do with the dog?
Yeah, good question.
Another important for any adoption, can I afford it?
Yeah.
When you adopt a dog, cat, rabbit, you are obligating, you are promising that dog that you are going to take care of it. That includes yearly vet visits with vaccinations, any medication required, etc.
And with our senior pets too, they're more likely to have just, you know, age-related health issues, or even just requiring more checkups for age-related reasons. So that's a very good point about just being aware of the costs. And if you're not sure, you can always consult with your veterinarian and they can give you a sense of what the costs are in your community as well. What would you say are some of the benefits to adopting a senior pet?
Oh, you don't have to go through puppyhood.
Oh, thankfully.
Like Abby, by the time a dog has reached 7, whatever years, they've settled down, they have a routine, they understand a little more that life does not rotate around them, and patience, loving, they're a little more tolerant of children in most cases, and you know, they're more tolerant of other dogs, perhaps cats. That's a one-on-one.
Good point.
But so they have lots of love. They have energy when they need it. You know, they can go for long walks, most of them, or to the dog park. They come home and they don't bug you again in 20 minutes. Let's go again.
Yeah.
So
So usually a little more predictable, to be more on the low to medium energy side.
mind you, you know, border collies are high energy, I think, until the day they pass.
Fair. There's certain breeds that just,
Yeah.
it's their brains. Their brains
Yeah.
never slow down, do
And
they?
the little Jack Russell
That
is going to
too. Yeah.
need lots of exercise, regardless of
age.
who you are and how old you are and how old he is.
I like with senior pets that you kind of know what you're getting. You know, when you first meet them and spend time with them, you get to see their personality. And of course, there's always things that might emerge after they've been in your home for a couple months and they're more settled. But overall, you know what kind of energy level you're getting. You also know if there's some behaviors or some, whether it's children or cats or something like that, that they really shouldn't be around. Those things are already determined at that point. So that's really helpful to help you decide if that animal is a good fit for your home.
The other thing I always stress, and again, any adoption, but especially our seniors, you know, most of the time they're being taken out of a home where they've been for a long time, and you bring them into your home, and you kind of expect that instant love, that instant bond, and they are just terrified. And so you have to give them space, time, and allow for a few of the 3 Ps. Pee, poop, puke.
Right.
And, just
Because they're seniors doesn't
Yeah.
mean that they won't be stressed and maybe have an accident in a new environment, of course.
and give them their own quiet place, a kennel, a corner of the living room, under the table, something, and that's their timeout place where they're safe from little fingers or you bugging them or whatever.
Yeah, and that's the same reasoning in terms of starting the Old Souls program, that some of the animals will do better in foster homes as well. The shelter can be very overwhelming if they've only ever been in a home their whole life, so they'll settle in more likely into a foster home that would be a similar home environment at least, rather than trying to settle into a shelter with all the smells and sounds that come along with it. And we tend to have a pretty constant stream of public during our opening hours as well. So people can also go online, so it's www.medhatspca.ca, and apply to foster senior dogs, and you can just tick off Old Souls. And they always will need more foster homes. We have a constant need for assistance with our dogs, and cats as well, whether they're seniors or medical cases or whatnot. So if you're interested in fostering, please check that out. Thanks very much, Trudy.
Oh, you're welcome. And as soon as I can, I'll be fostering for you guys.
Excellent. Thank you.
You're welcome.
So we are here with Dr. Storch at Cypress View Vet Clinic, and we're talking about, it's Senior Pet Month, so we're talking about our aging pets. And we wanted to ask Dr. Storch, what kind of things as pet owners should we be considering as our pets age in terms of their health?
Absolutely. So as they age, it's a long part of their life, right? So there's some things that we want to do just to kind of do for screening purposes. They're not necessarily sick at this point, but we want to catch any early diseases. So the biggest one that we talk about is doing some geriatric blood work. So even at sometimes we'll say geriatric blood work, not necessarily meaning your pet is truly geriatric at this point, but it's just a type of blood test that we can do where we can screen for diseases.
Okay.
The other things you want to consider is your pet's oral health, so the dental aspect of things. So quite commonly around this age, if they haven't had a dental, they may require a dental at this point, just to clean those teeth. Whereas with people, we go every 6 months. Dogs tend to never go for a dental. So getting that tartar and the bacteria taken care of is pretty important. Sometimes they're already at the point of very severe periodontal disease, which requires a lot of extractions. Right. They still tend to seem to be happy, and that's what a lot of people go based on. However, if you ever had a terrible toothache, or if you've ever seen anyone who never brushed their teeth, it's something that we don't tend to recognize in pets. Other things to consider is continuing to keep them active, right? We want to keep their joints in motion because everything in motion stays in motion. Right. So we want to continue that. And then of course we want to look at maybe adding in some supplementation. So stuff like glucosamine and chondroitin for joint health. The omega fatty acids can help with inflammation, as well as any other supplements that's recommended by your veterinarian. Right. And then again, with mobility, we always want to look at weight management. Right? So we have, unfortunately, a lot of obese pets. Yeah. And though we feel that we're giving them lots of love with food, which I know that I sometimes give myself lots of love with food. Yeah. However, the increase in fat actually increases the inflammation in the body, which can actually promote and lead to further joint issues. And then if you think about it, they're going to have more pressure on their joints. So stuff that helps reduce our weight and maintain our weight is really important at a senior's age.
Okay, and on that note, what about food? What should we consider for feeding our senior pets? More or less food, different types of food?
So there are age-specific foods out there. So it depends on what age your pet's at. Right. If they're starting to already show signs of maybe cognition or mental issues, which are where a lot of people say, you know, my pet is more anxious, my pet, you know, has trouble knowing to go outside, those types of things. Then we have senior-specific diets that actually help with cognition, and they're actually really great diets. So it's something that we should be considering as they age.
I know I had one dog that started to experience some symptoms of, the vet was calling it kind of like doggy dementia. She was doing random things like sitting and staring at the wall. It was kind of strange. So when I brought her in, they did exactly that. They recommended, it was like a brain development. And in her case anyways, it turned that right around and she stopped staring at random walls and hiding behind. She was hiding behind the toilet and doing kind of odd things. So yeah, that was really exciting to see. So one of the other things, and you did mention this already a little bit, that we often will deal with as our pets age is their mobility issues. And as pet owners, if possible, of course, we want to be preventative, but whether it's in prevention or in response to, what are some things as a veterinarian you could do to support our senior pets with their mobility issues?
So the first thing is to keep, like we've talked about, keep your pet mobile at home. Doing things that they love and enjoy is always helpful. But if you're noticing they're starting to reduce that, it could be an indication that arthritis is starting to develop. You know, maybe their weight is getting out of hand. So as a veterinarian, we can provide a lot of avenues for pets to help with their mobility issues. It depends on who you go to see for a veterinarian. They may do different things. Here at Cypress View Veterinary Clinic, we actually have a rehab department that we can help senior pets in their aging process. And one of the biggest things we see is difficulty going up and down stairs, you know, slipping on flooring, just having difficulties getting up in the morning. So some of those things, like we talked about, supplementation helps. Sometimes higher supplementation than you would normally give is ideal. Your veterinarian may also add them on some anti-inflammatories. So for example, there's a lot of NSAIDs, so non-steroidal anti-inflammatories we use. But one really interesting aspect that we can do is doing rehabilitation therapy. So in essence, doggy physiotherapy. So we have Sophie here, and Sophie is going to demonstrate some of the equipment that we have. So one of the biggest things in dogs as they age is they start to lose their core strength, you know, they start to sway their back and whatnot. So we have a wobble board right here, and the wobble board, it creates an unstable surface. So Mel is just demonstrating how she has to stabilize herself on the wobble board, and that leads to core strength. We can do things at home as well, but those exercises are going to have to be guided by one of our rehab therapists.
Right, because you don't want to push them too much too soon. It's probably something like when it's human activity that you're working up to certain activities.
Oh, for sure. And so we can do things like work them on other unstable surfaces. So we have, for example, the little Peanut and the doggy bone up here. So she goes back on a different unstable surface. So if we determine that she's having issues with the front or the back end, we can change that. Sometimes we can put them on the whole ball itself. We've got a variety of different ones, and then just help her with being unstable.
Right, you can see that Mel, who's the RVT, she's kind of providing a bit of stabilization there, and she's also, of course, giving the dog incentive, because this could be a little confusing and unknown to them at first, so giving a little treat as some incentive to actually do what you're wanting them to do to help build their strength in this case.
Yeah, and Sophie, she's a little more experienced. She's done this a few times, but we work with them slowly. So other things we've talked about mental cognition is we have proprioception, so their ability to detect where their feet and their body are in space. Okay. So that's what these are for. They're called Cavaletti poles, and these poles actually have them think about where they're going to place their legs. Yeah. So Sophie's cheating a little bit. She's kind of hopping over. Yeah. We want them to use all their legs.
One leg at a time, basically?
Yeah, and so this is just a cognition exercise. It can be done with a variety of different products.
I always thought about this as more of a mobility exercise, but I see what you're saying. It's more about their brain in this case.
It can be used for both. So it all depends on how they're set, where they're set. It can actually promote them in lifting limbs that they're having difficulties
if
with.
They've had some hip issues or something like that.
So, and then if we determine if your pet needs further help with pain, inflammation. We have other things that we can do. So we have different units. So if you know how you get the TENS units that people have put on your shoulders, and it kind of contracts the muscles and then releases, and it's just a nice muscle relieving machine.
Yep.
We do that with dogs as well. So we do that, and then we also have a laser, therapeutic laser, which we can actually use to help with inflammation and pain. And then, you know, we go to other mobilities, like using their hips more, their knees more, their front end more. Then we go into the underwater treadmill. Okay. And then as a veterinarian and as a therapist, then we can guide the workout program for them at home.
Perfect. So you do often send people home with activities and kind of homework and things that they can do at home as well. You were talking about the laser therapy. I want to go back to that for a second too. And I think we're going to try and set Sophie up for a demo. What do you need us to do, Mel? Do you want one of us to hold Sophie while you get it ready? There you go. So what types of things, Dr. Storch, would you typically use this laser for?
So the biggest thing we do not use the laser for is any cancerous process, right? Because what it does is it stimulates cells, it helps reduce edema, which is fluid buildup under the skin or into the joints. And if we do that with cancer, we know that cancer stimulates cells. So we never do it in that case, but we will use it in cases of arthritic backs, knees, you know, if there's tears that are recovering from surgery.
So
we
it's
do
muscle joint.
muscle joints, but we also use it on ears, we use it on anal glands, we use it on everything to help the healing process.
For healing process more than.
And so what Sophie's getting right now is a laser therapy treatment. She's wearing her beautiful goggles to protect her eyes from the lasers. And it's a painless treatment. And it happens pretty quickly, and we have a lot of dogs, and they have it routinely and quite enjoy having it done. So,
And it basically stimulates the healing process, you
yeah,
were
it
saying.
stimulates cells to heal. I'm not the best one to describe it. Mel, actually, the one performing the procedure at this point, is better at explaining it than I am. But basically, in general terms, it leads to healing, reduces inflammation, and helps with the pain. So
Wonderful.
Laser therapy promotes a lot of things and works in a lot of ways. The main thing that we'll use it for with senior pets is to reduce any sort of pain that they're experiencing. It also helps stimulate healing. So if we have a wound or something like that that needs to just heal a little bit faster, we'll use the laser therapy to help that along. And it uses a lot of science behind it, specific wavelengths of light that get right down into the cells and causes those cells to just start working a little bit better.
Wonderful. We could all use some of that, I think. And of course, she has her little goggles on to protect her eyes because it is a laser treatment.
That's right. There's specific wavelengths of light, so they can cause some eye damage without protective wear. Now, as you can see, some dogs will tolerate the goggles for a while. We take other precautions to protect their eyes as well as our own eyes.
Okay, perfect.
It is a low-level laser, so they don't feel anything. The worst part for them is having to sit still, and there's no heat and nothing that causes them any sort of discomfort while getting the treatment.
Wonderful. And they look pretty cute.
And they look pretty cute.
Yeah. Thank you very much.
You're welcome.
In terms of reasons why to adopt an older cat, of course, you know, they're probably the ones that are the toughest to adopt out at a shelter. So there's lots of people I know out there that would like to really help a cat that's truly in need, and a senior cat, in my mind, would be the most in need. Not everybody can see, you know, the benefits to adopting an older cat, and obviously with cats at this age, they're not going to have a super high energy level. They're going to be trained already in terms of litter box, so you shouldn't really have any litter box issues or anything along those lines. And we also have them all vet checked and make sure they're all up to date on everything before they're adopted out, so there really shouldn't be any medical concerns. If they had, for example, bad teeth, we would have that taken care of before adoption. So those are just some reasons to consider adopting a senior pet, and of course they have lots and lots of love to give still. So Diego is a 8-year-old male tabby, And at 8 years old, they are technically considered a senior. So he also does qualify for the senior discount rate. Diego is very friendly, and he's in the community cat room, so he does rotate out with other cats, and he gets along with all these guys just fine. So he could definitely go to a home with another kitty. He is also declawed. That's not something that we would have done to him. That's not something we choose to do with our kitties for a number of different reasons. But he was declawed by a previous owner, so that's important for a new owner to know. Some positives to that, of course, are that he wouldn't be able to scratch up furniture, but you would also just have to make sure that he doesn't appear to be in any pain. Sometimes declawings aren't done totally properly, and it can bother their digits, and sometimes it can cause litter box challenges, but we've had no problems with him here. So Simon is a Siamese. He is probably the oldest cat we've had at the shelter. He's 16 years old. So Simon is in quite good condition though. He is pretty agile still. He can still jump up on things, and he's quite healthy. So he is definitely adoptable, and he is looking for a retirement home. He is in the community cat room, so he's around other cats all the time, and he would be just fine living in a home with another kitty. But yeah, he's quite healthy overall, and 16 years old, as much as can be expected. He has a bit of that old man cat face, but he's super sweet and still cleaning himself and grooming. So that's all good signs when it comes to cat health.